Hello, good morning. This is Dr. Arndt Schwartz. I'm a cardiologist, professor of medicine, and director of our Heart Institute. Let me talk briefly about the heart, like you see here. The heart is the central organ in our body, and it's the engine. Without the heart, none of the other organs will work. I want to talk very briefly about a few basics, that you have an understanding. I had a patient the other day who told me, the doctor said my heart was good, but the next day I had a heart attack. So what's all that about? Keep in mind, the doctor probably did not say, your heart is good. The doctor probably said, your heart function, the strength, the mechanics of your heart was good, maybe because they did an echo or any other non-invasive testing. So when we talk about the heart and heart disease, we have to distinguish, and that's in very simple words, between three different entities. Number one is the mechanics of the heart, meaning the pumping, how strong this muscle pushes its walls together to push the heart, the blood in the heart into the body, into the brain, into the whole body. That's a mechanical function. The mechanical function we usually measure by echocardiography as well as by other invasive tests. It's easy to assess, and it gives us an idea about the strength of the heart. The strength of the heart can be good or perfect, but it doesn't mean the heart has to be good or perfect, because besides the mechanics, there is the plumbing, the arteries, the blood supply, the oxygen supply in the heart. And this is dependent on the blood vessels, the coronary arteries. And this is one of the biggest issues in modern medicine, whether or not someone has coronary artery disease, meaning blockages in those tiny arteries which support the heart with oxygen. So again, the mechanics, the function of the heart can be normal, but if there's a blockage somewhere in the arteries, that can cause a heart attack and death. So we have to distinguish between the mechanical pumping and the blood supply, meaning the plumbing, if you wish, of the heart. The third issue is the electrics. The mechanics can be normal, the pumping. The plumbing can be normal, meaning the blood supply. There might not be any blockages in the arteries, but patients come to us and tell us, I have palpitations, my heart is racing and it's irregular. So that refers to the electrical system in the heart. So the electrical cells are specialized cells which create the heartbeat, if you wish, our natural pacemaker, followed by subsequent pacemakers who make sure that the heart contracts after an electrical stimulus. So this is what causes irregularities, or what we call cardiac arrhythmias. So just to summarize very briefly, when you talk to your doctors and you talk about your heart, always keep in mind, ask about, number one, the mechanical function, the strength of the heart. Number two, what about the plumbing? Is there any signs for lack of oxygen, which we assess by stress tests or invasive cardiac catheterization? Number three, what about the electrical system? Is there any irregularities? So that's all you need to know for today for the heart. Thank you very much for your attention.